Keep hope alive. Keep hope alive.
Hi, everybody. I'm Santita Jackson. Welcome to this special edition of the Rainbow Push Coalition. And let's talk about it with Santita Jackson and friends. Conversation tonight, what are we talking about? COVID-19. We're going to have a candid COVID conversation because we need to. And we're going to have this conversation with some of the most trusted persons in the field of health. How did we get here in the United States? In the United States, we're only 4.5% of the world, and yet we're one quarter, little more than one quarter of the world's COVID-19 cases. Let me set the table for you. It's 107 million cases of COVID-19 all around the world. 27 million are in the United States. More than 400,000 persons have died. How did we get here, and how can we navigate our way to healthfulness? Well, we've got a tremendous panel with us tonight who are going to help us to break it all down. And if you don't mind, I'm going to put the ladies first. We are so excited to have Dr. Shanina Knighton. Who's Dr. Shanina Knighton? She is a registered nurse who has a doctorate in her field. And she wants to talk to you tonight about how we can prevent infection and spread. We've got Dr. Deborah Verholzen. She's one of the world's leading epidemiologists. She's Associate Dean of Public Health at Michigan State University. And of course, Dr. Ivan Walks, former head of the DC Office of Public Health. And then, of course, the man who's helping to lead it all for us, the head of the National Medical Association. This is the largest organization of Black physicians in the world. Dr. Leon McDougall, who's from The Ohio State University. Let us begin, and let us start with Dr. Knighton. You know, nurses are the unsung heroes, if you will, in the medical profession. They're the ones, when we're in the hospital, they sit with us for a long, long, long time. It's not that we don't love our doctors, but we do love our nurses. And we're very, very excited to have this young woman because she has a doctorate in the space. And she wants to talk to us about the infection of COVID-19, how we spread it, how we catch it, how we spread it. It seems to me, Dr. Knighton, a year in, I see a lot of people who use their masks sparingly, and if you will, to come up with another word, erringly. They wear it on their chins. They come into a building, Dr. Walks and Dr. McDougall, and they pull it down, and then they see you because they know you. They take their masks off in the car. It's like, oh my gosh, how is this spread? Is this airborne? What are we looking at with the coronavirus and COVID-19, Dr. Knight?
So for one, it's not something way anytime soon, and I'm sure our other panelists can allude to that. And unfortunately, there's this false sense of perception that as we continue to seek treatments, different vaccines, different solutions, that there's going to be this one size fits all. And so just as you alluded to, you know, going inside of a building, watching people use masks correctly and incorrectly, knowing that only 3 to 6% of the population cleans their hands correctly, you really do wonder, is it a matter of the government doing everything that they need to do? Is it a matter of people just not doing what they need to do? And so what I'm concerned about right now is now that we know what we should do, I'm not seeing enough campaigns or information about how to do it. So many people aren't aware of how to even wear how to wear a mask correctly. And so there's individuals, let's say they're wearing it beneath their chin. You have others that are deciding, you know what, I'm just going to have it beneath my nose. Yeah. And so we're still exposing areas, and many are missing why we're wearing them to begin with. And the assumption is that because we know that people are either asymptomatic, meaning that they may show no symptoms, or individuals may think they have an allergy, cough, and it can be something that's more severe. We run into a situation of where they don't recognize that the assumption is that we are all sick and that we want to keep our germs to ourselves to prevent it from being spread to others. And so there's a lot of practices that I think are lacking. in regards to seeing individuals and how they're handling them?
What practices are lacking? I have to tell you, I saw a young man just a couple of nights ago delivering food in my building. And as soon as he walked through the front door into the lobby, he took his mask off. I couldn't believe it. I was like, we're a year into this pandemic, and I don't know too many people who've not been touched by it. We know somebody who knows someone from it, or you know somebody who knows somebody.
Yes.
What is missing? What kind of campaign is needed? And if you could walk us through how we wear a mask correctly, wash our hands, seems very simple, but most of us do not know.
So when you mentioned, so it's one of the things like we're told clean our hands, right? And many don't think that, they don't think about it. They don't think, did I 20 to 25? Am I washing my hands? Am I cleaning in between? Am I making sure that I'm getting between where the thumb meets the hands? Am I scrubbing my fingers? Am I getting the back part of my hand? So there's often some side of the hands that are missing. And even for those of us that are in healthcare, we know that it takes years and years of practice of doing this just to make sure that we're doing it correctly. Well, a lot of individuals are still not doing it correctly. And I'm still observing it. Let's say if I'm in a restroom, when you bring up mask wearing, so I caution people. So just like now, like how here it is, you know, my shirt is a little bit low, Dr. Fur Holden, like how it's not low, but exposed. So if I have a mask on correctly and it's supposed to cover my face from here, if I put it up under my chin, and this is after a conversation of us talking to each other directly, let's just say that your mask doesn't protect your droplets from coming out of your mask, but mine's is doing its job. The minute I go to lower my mask and sit it down here beneath my chin, the next time that I raise it up, I've now taken the droplets that you've transferred to me, and I now have given them access potentially to my nose and my mouth. And we know that COVID travels through the eyes, mouth, and nose. And so I caution individuals that when they wear their mask down here, they're doing it against their safety. So it's not helping. The other piece of it is many don't recognize our cell phones are our third hand. They are with us all the time. We're constantly touching them. That same cell phone that you're touching with your hand, you then have now placed towards your mask or it's resting on your skin. And again, when we think about the proximity of our eyes, mouth, and nose to the germs that we're transferring to our face, that is something that we don't think of. So I think we really missed the mark of not just how to socially distance, practice hand hygiene, as well as wear masks, but it's how do we implement these things in our day-to-day lives?
Absolutely. Dr. Walks, you have had to oversee a city, a whole city, really a city state, if you will, the District of Columbia, as the former head of their public health system. When you hear Dr. Knighton, what do you think? I mean, what can a city, what should a state, what should our nation be doing to, I mean, a year in to let people know how this is spread, how this is transmitted, and what they should be doing? I'll get to policy in a minute, but I have to get practical first and foremost, because you've overseen a whole public health care system. And as I've shared with you, I have a very dear friend who has recovered from COVID-19. And this person had the highest regard for how the healthcare system that you oversaw, how this person was handled. This person said, I was called like clockwork the same time every day. They wanted to know the meds that I was taking. They wanted to make sure, and they made sure that I got well. They made sure that I got to my appointments. Please start with the practical. What should a public health department be saying?
Well, first of all, let me say I wish I could take credit for exactly what's happening now in the District of Columbia. It's good to hear that things are going well there, and that the folks in charge, Mayor Bowser and the Health Department Director, are doing a great job. It's good to know that, because you can't have a public health department dependent on the person who is there running it. There have to be structures and constructs in place. And those can't just include the health department. One of the advantages of when I ran the health department in DC and what's going on there now is you have strong leadership at the mayoral level and in DC right now at the deputy mayor level. Wayne Turnage runs that part of the district government. And it's a wonderful thing to know that it goes across departments. Public health is not just a health department issue. The public schools have to be aware and integrated in what a health department is doing. All of the other departments have to be a part of it. So the first thing you do is you want to make sure that your city is being run in an integrated fashion so that people, no matter what part of the city they touch, no matter what part of the state they touch, the message is consistent about what we want folks to do. Let me say this about public health, Santita. Public health is, a lot of healthcare is about getting people good information. Public health is about getting people to do something. We want you to behave in a certain way. That's typically a public health kind of a message. So everything that our good doctor just said about the mask and the hand washing, critical information to be consistently given across the entire jurisdiction. And then who is the message being given to and how do you identify the people it needs to get to? So linkages across barbershops, linkages across beauty shops, linkages across places where people are. This is why messages have to go out across the district. So in terms of how do you get the message out and how do you make a difference, it has to be an integrated message, the same message, but given to the community it's given that it needs to get to. So for example, yesterday was Sunday. Where was I? I was in church with the pastor giving a message about COVID to our congregation. And I think doctors and nurses and other healthcare people, public health people need to be out of our offices and in our community. I'm always happy to see Dr. McDougall out. I don't know when he's ever home because he's always someplace talking about how health gets into your home and into your habits, into your habits. That's where public health needs to be.
What about, as you said, it seems to me, a fully integrated system. I mean, because I have to tell you, I was in college and I was really struck by the fact that the head of the DC Public Health Department was very, very much a part of the community. And that is something that I've seen in Washington that is quite admirable. I think that's why I brought that up, because you all have been very consistent in Washington, D.C., which has been Chocolate City, which has been a city that up until Marion Barry really did, you had a black middle class, but you didn't have an entrepreneurial class. I mean, you had poor, you had just unmoving poverty, and that changed under him. And so I'm trying to find out what it is that DC public health is doing right. What is it? Because I'm telling you, I was struck by this person's experience, and I was so happy to hear that this is a public health department that is doing this, that treated me as I felt valued, and I felt that I would get through it because I had one person who calls me every day to make sure that I got my meds in.
Well, it's really hard to wake up and decide to treat people as if they're valued when you don't value them ahead of time. And this is one of the challenges with COVID-19 across our country, is that we are seeing that the constructs that we need to have in place aren't in place everywhere. We wouldn't have to talk so much about how to fix our public health system if the public health system was already funded equitably, and if it was equitably resourced across not just the funding, but the attention that people get. I could go on, and I won't, about inequities in healthcare treatment for people of color, but we see that every time we touch the community, we touch disparity every single time. And so a place like DC, where you have, it's no accident that we have an African-American woman mayor in DC, an African-American woman heading the health department. We have an African-American brother as the deputy mayor, but there's this caring about people who look like us that happens in a place where people run it that look like us. To a large extent, part of that is saying, you know what? I recognize that people that look like me can be anywhere. You mentioned the entrepreneurial class.
Mhm.
You can walk into DC. You don't know if the person you're looking at works in the building or owns the building. You just don't know. And so there's something about that diversity of accomplishment that helps to get us towards Dr. Deborah's favorite word, I think, equity. I think we have to get to equity, and we do it by respecting all of the individuals. I remember walking through DC one time and trying to be incognito, and there was a young man sitting on the sidewalk said, "Dr. Walks, I see it's you under that hat." And it's nice to be in the community where people know you. Why? Because when you come back to help them with information, they'll say, "Oh yeah, he was here yesterday when he didn't need me to do anything. Now he's back. I think he really understands a little bit about me and what my situation is." Because you know what? I can't worry about COVID-19 if I'm worried because I'm hungry. I can't worry about COVID-19 if I'm about to get evicted this afternoon. And so we have to look in an integrated fashion at our communities and what those communities need all the time so that people can pay attention to that public health message.
And I'm building to you, Dr. McDougall, because as the head of the National Medical Association, you've been looking at COVID, the coronavirus and COVID-19, this pandemic, but you and Reverend Jackson have come together with Dr. Deborah Furhold, and you have been leading the Rainbow Push Public Health Task Force and the National Medical Association, the National Bar Association. You crossed disciplines and you came up with a public health manifesto in the midst of this pandemic. Why a public health manifesto, and what's in it?
Thank you, Santita. I'm going to answer that, but I want to pivot to the discussion that just happened. We were talking about DC and the higher percentage of Blacks living in that community. That being said, let's look at other states that may not have that amount of collaboration, right? So, what states have some of the highest, the entire state, the highest percentages of Black Americans? Let's talk about Mississippi. Let's talk about Georgia. Let's talk about Florida, Tennessee, Alabama, and the like. And what do those southeastern states have in common? All of them have not adopted the Affordable Care Act. So, in light of this pandemic, you have some of the states with the highest percentages. South Carolina, I left them out of there, some of the highest percentages of Black people, and yet in the same have not expanded Medicaid, have not expanded opportunities to have insurance networks that entrepreneurs can buy into. So I think that's a focus that we need to have as a country, and our legislature class and folks really pay attention to that. I wrote a op-ed with former Mayor Landrieu concerning this issue that was published in the Hill. So that's a reference there. So I'm glad we're speaking to this percentage of Black people in a state, and how that lack of insurance and coverage can also be a factor in one's health and ability to obtain adequate health care. And so, Reverend Jackson, so this was about March of 2020, and we met with Reverend Jackson, and Reverend Jackson said, "We need a 10-point plan." He said, "We need a manifesto." Dr. Duffer Holden and I and you were involved with this process, and it eventually became a 12-point that was published on April 15th of 2020, involving a collaboration with the Rainbow Push Coalition, the National Medical Association, and National Bar Association. And quiet as it's kept, those 12 points are still pertinent today and really speak to prevention and the physical distancing and using technology to communicate, especially in places of worship and to really prevent this spread. So it's something that has led to the development of the National Medical Association's task force on COVID-19 vaccines and therapeutics, and going around and speaking to the pharmaceutical companies about the safety and effectiveness and comparison of cohorts of Black people compared to others. So there's quite a bit going on in news, Santita.
You know, when we get on the other side, I really do want to focus on equity, but I would like in these last couple of minutes before we go to break, in about 90 seconds, if you can tell me why, Dr. McDougall, you chose to have a public health manifesto. It seems to me that you wanted to look at public health broadly, not just, it seems like the pandemic has been an opportunity for us to look at the inequities in the system, not just inequality, but inequities. In about 90 seconds, why public health broadly and not COVID-19 specifically?
Well, Reverend Jackson came up with that idea of manifesto. So, oh, that's good, a manifesto. We're going to drop a manifesto on the United States of America. And it also includes the fact that we need to increase workforce diversity. We need more Black nurses. We need more Black pharmacists. We need more Black doctors. We need more Black Deborah Fur Holdens. We need public health officials and leaders that have spoken with us today. We also reached over the horizon to the continent of Africa and speaking to the United States withdrawal from the World Health Organization and needing to be engaged and to ensure that adequate resources were being supplied to the continent of Africa. So it is a broad, speaking to the least of these, speaking to incarcerated persons, persons in nursing homes, and the like, and is as a pertinent today.
Well, you know, when we get back on the other side of the break, we're going to look at inequities in the system. It seems that COVID-19 has helped us to see it's been a blessing in disguise. Now we have to deal with inequality and, more than that, inequities. And how do we get there? How do we get from where we are to where we're supposed to be? Back in just a